Have you ever started a medication and weeks later felt like something just wasn't right? Not something obvious. Nothing you could clearly point to. Just a quiet sense that your energy is lower. Your thoughts are a bit slower. Your balance slightly less steady than before. And when you mention it, people often say, "Well, that's just age." Now, this is where I want you to pause. Because in many cases it isn't age at all. It's something far more subtle and far more common. I've been a physician for over 4 decades, and if there is one pattern I've seen repeatedly, it is this. A patient begins with one manageable condition and over time develops several new symptoms. Not because their body suddenly declined, but because the treatment itself was never fully reevaluated. And before we go any further, let me say this clearly. What I'm sharing here comes from my experience as a physician. It is not personal medical advice. And if something resonates with you, you should discuss it with your own healthcare professional before making any changes. Now, if you appreciate calm, thoughtful explanations like this, you may consider subscribing, not for urgency, but for clarity. Let me explain something important. Medications are not inherently dangerous. They are often necessary, sometimes life-saving. But after the age of 50 or 60, your body handles them differently. The liver processes substances more slowly. The kidneys filter less efficiently. The brain becomes more sensitive to chemical effects. And this is where most people make a quiet mistake. They assume consistency in the body when in reality the internal environment has changed. So let's go through some of the most common medications that require careful attention in older adults. Not to create fear, but to bring awareness. First, sleeping medications, especially benzodiazepines and similar drugs. These are often prescribed when sleep becomes difficult, and at first they seem helpful. You fall asleep faster, the night feels smoother. But over time, things begin to shift. You may feel groggy in the morning, your thinking may feel slightly slower, your balance just a little less reliable. And this is where most people don't make the connection, because the change is gradual. I've seen patients who thought they were just aging, when in fact their medication was quietly affecting their nervous system. Second, opioid pain medications. These are strong, sometimes necessary, particularly after surgery or with chronic pain conditions. But in older adults, they behave differently. They can slow reaction time, affect breathing patterns during sleep, increase confusion, especially at night. And here is something many don't realize: even low doses over time can accumulate in the body, leading to effects that are subtle but significant. Third, anticholinergic medications. Now, this term sounds technical, but the concept is simple. These medications interfere with certain signals in the brain. They are found in allergy medications, some antidepressants, and even treatments for bladder control. And this is where things become important. In younger individuals, the brain compensates well, but in older adults, these medications can affect memory, focus, and clarity. Sometimes they contribute to what people describe as brain fog, and this is where many cases are misunderstood, because the symptoms resemble normal aging when in fact they may not be. Fourth, anti-inflammatory medications like ibuprofen. These are widely used, often without much thought, for joint pain, back pain, daily discomfort, and occasionally they are perfectly appropriate. But long-term use, especially in higher doses, can quietly stress the kidneys, irritate the stomach, and increase cardiovascular risk. And this is where many people are surprised, because the medication feels familiar, almost harmless. Yet the cumulative effect tells a different story. Fifth, blood pressure medications. Now, managing blood pressure is essential, but sometimes the treatment becomes too aggressive, especially when multiple medications are combined. And what happens then? Blood pressure drops too low, particularly when standing up. This leads to dizziness, unsteadiness, and in some cases, falls. And falls are one of the most serious risks in older adults. Sixth, acid reflux medications, particularly proton pump inhibitors. These can be very effective in the short term, They reduce discomfort, protect the stomach. But when used for long periods without reassessment, they may interfere with nutrient absorption, calcium, magnesium, vitamin B12, and over time this can affect bone strength, energy levels, even nerve function. And this is where routine continuation becomes the problem. Seventh, medications for blood sugar control. In diabetes management, balance is everything. But in older adults, overly strict control can be risky. If blood sugar drops too low, the effects can be immediate. Confusion, weakness, shaking, even loss of consciousness. And this is where treatment goals must be individualized, because what is ideal in theory may not be safe in practice. Now let me pause here, because this is often the moment where concern arises. You may be thinking, am I taking something I shouldn't? And the answer is not necessarily. The issue is not the medication itself. It's how it fits into your overall system, and this is where a deeper concept comes in. What we call polypharmacy, simply put. The use of multiple medications at the same time. Each one may be justified, but together, they interact. They amplify side effects. They alter each other's metabolism. And the body, especially an older body, has to manage all of it simultaneously. There is also something known as the prescribing cascade, and I want you to pay attention to this. A medication causes a side effect. That side effect is mistaken for a new illness. A second medication is added. Then another. And gradually complexity increases. I've seen individuals who started with one issue and ended up managing 5, largely because of this cycle. Now, what can you do about this? Let's make it simple. First, schedule regular medication reviews. Not just when something is wrong, proactively. Sit down with your doctor or pharmacist and ask, do I still need this? At this dose? Second, notice subtle signals, not dramatic symptoms, small changes. Your energy, your clarity, your balance. These are often early indicators that something may need adjustment. Third, simplify when possible. If 2 medications serve a similar purpose, perhaps one is enough. This requires careful evaluation, but the benefits can be significant. Fourth, be cautious with over-the-counter medications, especially long-term use. Many people don't mention them, but they matter just as much. Fifth, keep a complete list. Everything you take. Prescriptions, supplements, occasional medications. Because interactions often occur where people least expect them. And this is where most people make another mistake. They separate medications into categories in their mind. This one is for sleep. This one is for pain. This one is just a vitamin. But your body doesn't separate them. It processes everything together. Now, let me leave you with this. Medications can extend life, reduce suffering, improve function. But after 50, they require a different level of attention, not fear. Awareness. Because your body is no longer the same as it was at 30 or 40. It is wiser, yes, but also more sensitive. If something feels slightly off, it's worth exploring, not immediately assuming, but gently questioning. Because sometimes the smallest adjustment can restore clarity, stability, and ease. If this gave you a clearer understanding, you may consider subscribing. Not for urgency, but for thoughtful guidance that respects your experience and your health.